So that's us up to 4:05. So again, welcome to everybody. And Sasha, can I hand over to you now?
Yeah, thank you, Mark, and hello everyone. Good to see you all again. So I got the remit to talk about staff wellbeing, but just before I start talking about staff wellbeing, I just want to reflect on last week. Last week was Mental Health Awareness Week, and we did a whole series of events and a campaign just across our district, just thinking about what does it mean to be well, and the theme for Mental Health Awareness Week this year was nature. And it just felt really fitting that we've spent a year almost in lockdown in various ways that, you know, a lot of the things that have happened have really brought people either staying indoors, staying disconnected, and just some of the things that we've heard people share here in terms of fears and emotions, just really connecting people back out to thinking about going out, being in the open and connecting with nature, and just the positive impacts that can have on people. But also I think one of the things that really came to head was we started really reflecting on what it's felt like this past year to be at the front line of delivering the support, of working with children and people who really, you know, we've heard how much mental health has impacted on children and people, and just thinking what it's been like to be at that forefront. And I was reflecting with the team in terms of some of the things that have been put in place to support staff, but also just some of the things that probably happen every day that you all do really well in terms of what makes, you know, us have good mental well-being. And the key things that kind of really lead to that are about having good connections, having good relationships, having people that you can turn to and speak to, somebody trusted, and having those basic things in place that sometimes we take so much for granted about our housing, about our security, and you know, one of the things that we've definitely talked a lot about is the impact of poverty on children and young people. So all of that has been really at the forefront of the team in terms of what they've been developing, what we've thought about in terms of providing support. And there have been two things that we've really put in place for providing support. The first probably was towards the end of the first lockdown, and we really started seeing the impact of what loss meant for people. And this wasn't just about the loss of life, but really thinking about loss of those connections, loss of that connectivity, of the usual things that we all think about in terms of keeping ourselves well, going out, exercising, having friends, and all of those things came to, you know, really at the forefront of understanding what those meant, and what the loss of those things can mean. And one of the services that we set up last year was the grief and loss service, and I think I saw Laura on the webinar just a short while ago, and that service really was there set up to really take that broader view of loss and support people through what was a really difficult time with a various range of offer of practical support, but also emotional support for people. And then I think the conversations that we've had with yourselves and hearing from yourselves about the impact of lockdown, and, you know, teachers, school staff in some ways have been the most important. I think the role of teachers in a child's life has never been so much more important, and how we've really thought about that role that teachers play. We've all reflected on probably the teachers that we've had in our own life, but also how as teachers you are that person who comes into contact with children and people, have that understanding holistically of what's going on in their lives, and how they react and how things are going on for them, but also how emotionally tolling that this past year has been on everyone. And so one of the services that it was just so brilliant to set up with everyone's input was the emotional wellbeing support for head teachers and senior leaders, which I think has the name of SWOOSH, so the School Staff Welfare Support Service. And this really built on providing that emotional support for people, but also thinking about the peer-to-peer messages. How do you all support each other? And I think there's probably been some fantastic examples that we've heard from people of how you've all supported each other through this, in terms of sharing your knowledge, sharing best practice, the weekly support groups that have been set up for people, having access to good quality information and guidance and reports about what to do and how to do that. And these webinars have been a great way of being able to share some of that quality information. But then also really thinking about those wider support offers and information offers. So the e-learning portal has been a great way of providing that support. The webinars for school-based staff, and really looking at some of the emerging themes that have come through. And then the support from Ruth Dennis's team, the educational psychologists, and how that has really supported schools and staff, and some of the messagings that have come out from that team in really thinking about, yes, we've come through a really difficult year, but how do we really build on those concepts of resilience, of bouncing back, and so much to celebrate in terms of what everyone has achieved together. So I think some of the key messages around school support is really having that opportunity to listen, having that opportunity to have those spaces to come and scream and share what's going on, and then have that access to really good information, support and emotional wellbeing support for yourselves, that then the young people that you're supporting can be really well supported. And that's really what we want to be able to establish, that all of our services have that opportunity to provide that listening, to provide a window of support, and really work together by building some really good services that actually then deliver support throughout your schools. And I'm so excited by one of the actually what's come out of this, in terms of how we're all working together to establish the Living Well Schools framework, and how that framework will really provide schools with that holistic opportunity to not only support children, young people and families, but support the workforce, and really thinking about our workforce and what it means to look after the workforce, because having a great workforce means we'll have great schools. So I think I'm going to stop there, and happy to take some questions. And I know Ruth and Laura are also on the call if you want to hear anything about the specific offers that we've got.
Brilliant, thank you so much, Sasha. So if anybody's got any questions for Sasha, please be brave and come off mute, or alternatively just put a question in the chat. So if anybody's got anything, please let us know. Laura, is there anything that you want to add? We'll hear from Ruth later on, but Laura, is there anything
Laura's on with me later.
Oh, apparently Laura's also on later. Nevertheless, I'll give you the opportunity now, Laura, if there's anything you want to add to what Sasha said.
I don't think there is anything to add, really. It's been a real privilege to work and support people. The overwhelming thing for me has been that people are very obviously intelligent and also emotionally intelligent, and they've been so dedicated to supporting the children, but because of the virus it has just been too much, and there's absolutely no shame in needing that little space for yourself just to get some balance, and I'm really pleased that people have embraced it, really.
That's brilliant. Thank you so much, Laura, and again thank you so much Sasha. So what we'll do now then, I'm not seeing any questions that are coming up, is perhaps for the first time in this webinar history, on time, I'll hand over to Duncan. So Duncan, I'll try and do some magical, or do you swap seats?
Yeah.
Is that public health recommended? Yeah.
Try not to touch your keyboard. Hi everyone. Okay, so it's going to be a quick double act between myself and George again. So I just want to take you through the local figures and give you a bit of information on the Indian variant as well, on what I've heard around that. And then also just quickly go over the rationale about the statement that we put out on face coverings last week as well. And then we've also had a lot of queries that started to come in today about all sorts of things, with schools opening up again, which is great. But you're obviously all worried about school trips and all those sorts of things, and parents' evenings as well. We've had a lot of comments about that, and we are working on some guidance on that. And then George is just going to take you through the recommendations about the system of controls that we've had for months now in schools and what our recommendations are between now and the end of term. So to start off with, just the current situation in Bradford and England. As you'll know, on Monday, we moved into step 3 of the government roadmap. So the key implications of that are that most outdoor social contact rules have been lifted. So that's really changed. 6 people or 2 households are now allowed indoors. And indoor hospitality in hotels, pubs, restaurants, bars, all that sort of things opening again. So the combination of that is a lot more people socially mixing, unfortunately, which is good for the economy, good for people's well-being, but does bring some extra risks as well. So, sorry, let's get my pen. The other thing is that people, although the Prime Minister always asks and expects people to be sensible, the sorts of questions that we're getting do indicate that people are really pushing these rules. So we're getting things like, if I have 30 people in my garden, can I also have 6 people in my house? And then can I swap those 6 people as long as I keep 30 people in my garden? So the fact that people are asking those sorts of things tells you that people are obviously going to be pushing it a little bit further from the guidelines. So it does represent a bit of a threat. But in terms of what the data is telling us, the 4 tests that the government has to move completely out of lockdown on June the 21st, the first one's around where the vaccine programme is rolling out. And we've got 61% of people across Bradford district now have had the first vaccine, and 32% have had the second. So 2/3 are covered with 1 jab and 1/3 are covered with 2, which is good news. There still are some inequalities and lower vaccine uptake in the middle of Bradford and the centre of Keighley, but there's all sorts of work that's going on in trying to increase that vaccine. So there's additional walk-in slots, pop-up clinics, there's a bus that's going around, there's pharmacies that are coming online for vaccination and so on. So there's all that work going on to try and speed up the vaccination programme. The second test is around evidence that vaccination is reducing the impact on the NHS in terms of hospitals and deaths. And what we know from that is the numbers of people in hospital in Bradford fall further. So it's 16 patients across Bradford district are in hospital. That compares to over 100 even sort of 4 to 6 weeks ago. So that's still coming down, which is good news. And we've had 2 deaths from COVID in Bradford for the week ending the 16th of May, which again is the lowest number of deaths that we've had from COVID for months and months and months. So that's good news in that sense as well. So that's the second one. The third test is around infection rates, that a rise in infection rates don't risk NHS capacity. The Bradford infection rate is 43 per 100,000. So that compares to 40 across Yorkshire and Humber and 25 across England. So we're not that much above the Yorkshire and Humber average anymore. And we're getting about 30 cases a day across the district. So 30 known cases out of a population of about 500,000 every day. So it's sort of low infection rates. And we haven't really got any particular areas that are much, much higher than elsewhere as well. It seems to be coming down everywhere, which is quite good news. We occasionally get a spike in one particular area, but it tends to be quite short-lived now. But there is, the modelers and Public Health England are expecting a rise in infection rates over summer. It's just to sort of warn you that you may see that in the news, and that's because of the opening up. So that's the third thing. And then the fourth thing is the new variant. So the variant that originated in India, which is causing all the panic in Bolton at the moment. You'll have seen that on the news. So the new variant is now accounting for about 80% of all cases over in Bolton and Blackburn. So it's spreading. And there's very good data on the internet about this, and it shows you that in Blackburn it's about 25-30%, in Pendle it's about 20%, so it's on its way over the Pennines towards Bradford, I'm afraid. I don't think there's any way of particularly stopping it now, but what we do know about it is that it seems to be more infectious, but the upper limit of that is 50% more infectious, and that's not a definite yet. And the pessimistic view is it's 50% more infectious. The more positive view is that it's maybe only 10 or 20% more infectious. So we will wait to see. But the important thing is, how dangerous is it and how is it transferring into hospitalisations? And at the moment, the evidence is showing that there's a low risk of hospitalisation from the Indian variant. It doesn't seem to be any more dangerous than previous variants. And if people if you've vaccinated and you do still get an infection through an Indian variant, it really brings down the severity of that infection as well. So in terms of that, there's some sort of positive news. We realise that vaccination for younger teachers that won't have been offered the vaccination yet is still an issue. We're trying to work through that, and I know that there were some additional slots that were offered to certain schools in higher infection areas. It's just really, really difficult, I'm afraid. We still haven't got permission to go off that government criteria and offer vaccinations. But everybody down to the age of about 38 now, or if you've got any sort of clinical vulnerabilities, should have been offered a vaccine. So a lot of the population now within schools will have been offered the vaccine. So that's the situation with the Indian variant. It really is sort of watch this space. So the second thing was just about the face coverings. So we have gone off government guidelines on this, and we sent a statement out that hopefully you got last week. But to re-emphasise, this is a public health recommendation to you. We've got no legal mandate over schools to tell you what to do. You run your own schools, and it's up to you whether you take the recommendation. But the rationale for that was that the new guidance came out last week to say that all visitors to schools and staff should be wearing face coverings in corridors and communal areas, but in secondary schools, and special schools and FE colleges, children don't need to wear face coverings in the classroom anymore, and they don't need to wear face coverings in school. That seemed to us to go against a really good system of controls that we still had in schools. And the head teachers that I spoke to and that we speak to regularly said it's much easier to take things out than to put things back in again. And this is what George is going to speak to you in a little bit. So we've continued to recommend face coverings in schools, in corridors, not in classrooms. I think that's a good compromise in terms of letting teaching go on without face coverings. But this is all about prevention, and we don't want to get to a point where we've got lots of outbreaks again and we put face coverings back in after it's been missing for 3 weeks. So that was one thing. The other thing was the rules for us all as adults in any other indoor setting is to wear face coverings. Children have to wear face coverings on the bus, and they have to wear face coverings when they go into sweet shop, when they're going from school. So why tell them not to wear them in classroom now? And kids have been saying us all through the pandemic that there's an irrationality in these rules. So that's why we thought we could keep it consistent. So that was another thing. And then the other thing was that the DFE guidance itself, when you look through the small print, says that the Director of Public Health has some flexibility and local autonomy on this to make changes. And we've still got about 30 schools with clusters or outbreaks going on. So we felt that was a good common sense public health recommendation. But to re-emphasise it, it's a recommendation from Public Health, and it's one of a range of interventions. No intervention by itself will control the pandemic. We need a range of interventions. They're all marginal, so we try and do them as much as possible. So that remains our recommendation for you for face coverings. And then the final thing that I just wanted to say was about the reporting of cases. I know that you may be getting low numbers in your school and you may be seeing infections coming down, but the only way that we can really get an impression of what is going on across 200 schools in Bradford is to get your web reports through. So please continue to send them, because it enables us to look at whether it's staff or children that are getting infections, what type of schools, where they are in the district. And we've brought additional resources in to support schools, and that's very dependent on having the intelligence that we know, because we can take those. We'll have to take those resources out again at some point, but I don't want to do that too early. So your information about infections is really important as well. The final thing that we're getting questions about is about parents' evenings and school trips and things like that. Should we, shouldn't we do that? I mean, our advice with this is to follow the government guidelines. Government guidelines is that groups of up to 30 people, if you've done a risk assessment, can go ahead with indoors. And we don't want to stop school trips, parents' evenings, and all those sorts of things. They're really essential to education and to children's wellbeing. So just keep applying the system controls and prevention and minimise risk within those events. That's all we'll say. Do your risk assessment. And the other thing, the question that we're getting is about exam papers and teachers passing papers around schools and things like that. The evidence on transmission of COVID via bits of paper, bits of plastic, things like that, it's all hypothetical. Because somebody's demonstrated that a virus can survive on plastic for 3 days, it doesn't mean that we get lots of outbreaks because of that. So it's hypothetical evidence. The real value that for school controls is putting your efforts into good ventilation. I'd focus more on good ventilation, social distancing, than worrying too much about papers. If you really wanted to do a really strong risk assessment, it's just about quarantining books before they go back into the library and quarantining exam papers, minimising the amount of papers that you take home to mark, maximising the amount of electronic work that you do rather than papers. All those sorts of things are really marginal effects. But it's aerosolisation within schools that spreads COVID much more as a transmission route than virus hanging around on plastics and so on like that. So that'll be my advice on that one. Okay, I'll just hand over to George now, who's got a few slides as well, just to take you through some of these issues as well. George, over to you.
Okay, good to see you all again. Let's see if my screen share works this time. Okay, basically it follows the rationale that Duncan was talking about, a lot of changes in the COVID system of controls, but we have a hard core of controls that should be maintained across all those changes. So in the beginning of the year, for example, we have a lot of changes in the lateral flow testing strategy, if we need a PCR or not, or in which case we need, if community center or school-based tests. So I think we are now in a different stage in which we have a pretty stable hard core of controls that include ventilation and hands cleaning, all this, but also the asymptomatic testing strategy, the contact tracing rules, and all the system for reporting and having support for the local authority in the case of outbreaks in schools. What we need now is to each new change, rather than updating all the guidance that we have in the BSO website and changing small sentences and sometimes something in page 13 of a long guidance that we will not look for. Instead of doing this, or beyond doing this, we prepared the table of the expected changes that we'll have over the next few months, because we have now some predictable changes that are set up in the roadmap for easing lockdown. So what we want to highlight here is that this is a live document that will change over time. We will continue updating and putting some important key messages on the website, but you can refer to this table that we will update today to the Bradford Schools website as a kind of the latest word in what has changed recently, even if we have not updated the other guidance documents. So basically what we have is that because of all this rationale of multiple sources of information, and also because we need to give you consistent advice so you can give consistent advice for the public, we have separated the COVID system of controls in two big bunches. One of them is the universal COVID control measure. So we do not expect this to really change, at least until the end of the summer term and possibly beyond that, possibly for the autumn term as well. So isolation of suspect or confirmed cases, reporting to the council and contact tracing, all the hand space and cleaning strategy. I don't think this will really cover. The asymptomatic testing program has reached a stable stage now, but we still have the possibility of in the future this changing, but I think it will be much more changed. Like, for example, in the case of an outbreak, we implement surge testing, or we distribute more testing for more people to do at home, and not a change in the core strategy of the asymptomatic testing of the school communities and parents. The use of PPE other than face coverings in situations in which you need to deal with a case is possibly a universal measure as well. And the ventilation of indoor space that has gained more space in the public health advice, because of what Duncan has said, it's much more important for you to keep the environment ventilated than to pay extra attention to cleaning all the surfaces and under the chairs and under the tables and so on. So this is the universal control measures. And then we have a group of measures that we know that will change and that possibly will change in the near future. We know that face coverings advice has recently changed. And this is kind of a controversial advice because we are taking a more cautious approach in the council, and Duncan has explained the rationale for this, but this is something that can generate some confusion. Parents can challenge the head teachers, for example, with the document of government saying that is different from the document. So we are adding this kind of changing control measures to this table that I'll show you in the end of the presentation. So use of face coverings is changing. Social distancing is possible to change, not now, but after 21st of June, when all social contact restrictions will be lifted, according to the Prime Minister. It's possible that they will reveal things like, for example, the distance between 1 and 2 meters, or if it's really needed to have some kind of distance in outdoor space or only indoor spaces. After school sports and recreational activities are also changing alongside the changes that apply for all events and social gatherings in general. But we have some specific rules for these groups, for example, in terms of number of attendees. That I'll also show to you. The same applies to parent and child groups. So in step 1 of the roadmap, parents and child groups were only allowed to vulnerable children, and then they were allowed outdoor to all children, and now they are allowed outdoor and indoors to all children, and then the number of attendees will increase from 15 to 13. So it's a lot to take on just following the whole guidance. It's easier if you have just a table like this one that I will upload today, in which you have the specific COVID controls in one side, so the 4 ones that I just mentioned: social distance, use of face coverings after school activities, and parent and child groups. And then what is the current advice and what is expected to change at each point of the roadmap. So for example, for after school activities, indoor entertainment will open. So an educational activity that takes place, for example, in a library, in a museum or something like this, can go on after the 17th of May. From the 21st of June, the limits of attendance to outdoor activities are expected to be lifted. So if you had a limit of 30 children under 5, for example, 30 children of any age, to a kind of a group or sport activity, this restriction will be lifted. The parent and child groups as well. So we allow now 15 people to attend both indoors and outdoor groups. And this is possibly going to increase for 30 people, or possibly no limit at some point after the 21st of June. So this is just a snapshot. I will not go into details of each one. Duncan commented about the face coverings. All about social distance is still speculative. And what we have more consistent is the change in the number of attendees of out-of-school activities. We have a specific guidance for out-of-school activities uploaded in the BSO website that will also be updated constantly following these changes in government advice. But you can also refer to this table to check the latest advice in the case something has not changed. And then just returning to the previous slides, there is another group of changes that are much more related to how the schools translate the social restrictions and all the COVID control in terms of operations. So we are not expecting, and we do not advise that any change takes place before the end of this term. So any changes in the bubbles arrangement, in social distancing outdoors, in large gatherings, would generate a lot of controversy from parents, a lot of reorganization needs. So teachers, even if overwhelmed, are kind of used to these arrangements. So what we are now expecting is that no changes will be announced by the DFE up to the end of this term, but possibly over the summer break and for the beginning of the autumn term, some of those arrangements might need to be reviewed. But we are expecting government advice on that. So that's it. You can look at the website later today and check for the table in details. It has more than it's here. It's just a snapshot. And this is expected to be kind of the latest source of advice in case of doubts or queries that you were not able to answer through the specific guidance. That's it. 5 minutes.
Excellent. Thank you so much, George. So any questions for George, please do put them in the sort of a chat. We'll doubtless sort of got to pick up on some bits and sort of pieces. I also see that Helen's put something in the chat, so we'll come back to that also. But if I can hand over to you now, Ruth, that'd be great if we can hear from you.
Hi, yeah, thanks. Hi, everybody. Katie's going to do my slides for me, I think, so I'm just going to wait for Katie to stick that there. Marvellous. There we go. So, hi, everybody. Ruth Dennis, principal educational psychologist. I know everybody might by now. So I was just going to do a little bit this afternoon on some of the work that we've been doing with the mental health champions at auditing how children have been coming back into school, and give me some feedback from that. So next slide, Katie. So the context of this is that Sasha's team and Public Health asked that we carried out a piece of work trying to get a bit of a feel for how are children responding when they're coming back into school. And so we decided to use the existing mental health champions framework so that as they meet every half term, we would carry out an audit using mental health champions, not to actually go out and check every single child in your school, but to give us a sense check of what is it feeling like in your school in relation to children and young people's mental health, and how are they presenting within your schools. So it is based on the views of the mental health champion, but it's intended to give you that sort of sense check of what is the emotional feel, what's the emotional climate in the school at these various points. And so now we've just finished our 4th data point, and so we've got a reasonable amount of data to share. So next slide, please, Katie. And just the the key principle of this was, again, it comes back to what I talked about last time, is trying to maintain a balanced view of how children are responding to COVID. So it's based on not over-medicalising or jumping to diagnostic conclusions. So if some children are sad at some point, that's a sort of fairly normal reaction to a fairly abnormal situation. And so not concluding that just because somebody's sad one day, that means they've got some sort of like serious emotional well-being issues. And so not over-medicalising, appreciating that it's normal for children to worry at some point about these things. We've all worried at times over this 18 months. And understanding that things are going to change over time. And again, then using that to help us build on the resilience factors for children and people. So next slide, please, Katie. So I think this is probably not much of a shock to you really, but sort of like consistently over the 4 audits that we've already done, the general perception is that 94% of school mental health champions reported that almost all of their students are happy to be back in school. I think there was a worry that a lot of children would be nervous and scared about that, but most students, mental health champions report that they are happy and positive about being back in school. And a lot of that is about being able to see their friends again, which I suppose suggests that children have felt isolated during lockdown, but being able to see their schools, see their friends in school has been a really positive thing for them. And apart from the teachers, of course, but seeing their friends has been a good thing too. And this was a hard question to sort of like phrase, but basically it was trying to sort of like get a feel of, have children got enough resilience? Have they got enough mojo to get them through whatever might happen next to them? And again, 90% of mental health champions felt that sort of at least half and almost all of their children had a sort of like a positive view that they were okay and were moving forward. So next slide, Katie. Interestingly, so things about, then we sort of focused down a little bit on academic aspects. And so the aspects around, the question was, I feel ready to get back to learning. And then the mental health champion has to sort of rate how like their cohort that is. And I think as you see from that, sort of like within primary school, mental health champions felt that about 81% of the children felt ready to get back to learning. A little bit less in secondary school, and there was an issue around special. I guess the number of children in those schools and the sort of like number of schools mean that if there weren't, the data may be slightly iffy. So I think that's maybe not one to sort of like dwell too much on. Interestingly, the one about I'm confident I'll be able to catch up with missed work. So most students, sort of about half of the mental health champions felt that about half of children felt confident in their ability to catch up with work, and that was at audit 3. And it was similar in audit, sort of like across both domains there. But what they found was that as they've gone through, and so between audit 3 in February and audit 4 at Easter, there was a slight deterioration in that. So they felt that students were more concerned about being able to catch up as they've actually gone through and from February to Easter, which is quite an interesting finding. Okay, so next slide, please. some of the, yeah, that one. Yeah. Some of the questions also related to aspects of children's lives around different elements. And so there was an interesting one about food poverty there. And so, and this was done, so the data's been sliced in various different ways. And so for schools where they they have less than 25% of students on free school meals, most of the mental health champions felt that the children were eating well, even though there was some deterioration over time. And so it's gone from 93% down to 73%. And then when we looked at and sliced it for more than 25% of children on free school meals, there's clearly the mental health champions felt that there is a deterioration in children's eating over that time, or their perception is that children are eating less well. So when they came back and in the, I think it was, somebody's just put a message over the top of where the data is, but I think it says at time point 2, there was sort of like, it was 77%, but that's gone down to 54% over that period of time. So it's something that we need to be sort of aware of. Next one, please, Katie. Other slicing, and I've put the links into this for you because I think sort of trying to sort of like hold all these numbers in your head is really pretty impossible, especially at this time of day. But there was some interesting findings as well around differences between schools in more economically deprived areas and schools in more advantaged areas, and the confidence of children being able to bounce back, and the confidence in being able to catch up with the work. And so in those schools, in the most deprived areas, there was less confidence in their ability to catch up, whereas in the more deprived areas, there was more confidence. Might be obvious, but it's also quite interesting to have that captured in some data. Next one, please. And the final bit that we did was we did some work around, we had a parallel staff audit to try and look at, so how, you know, we've asked how the students are feeling and have the perception about how the students are, but we also wanted the mental health champions to comment on how are the staff feeling coming back and over these time points as well. And interestingly, so 90% of mental health champions felt that between many and almost all of their staff will have to be back at school. So that's a good job, guys. It's everybody was happy about that. And feeling ready to get back to teaching. Again, mental health champions felt that most of their teachers were ready, and that was something that was a positive step. But again, there's something about there's less confidence in those children from more deprived wards being able to catch up with work, and that's been come through in the data. So if for those children who attend schools in more deprived areas, there's less confidence in their ability to be able to catch up. So I don't think there's any more cases on that. Yeah, I think that just sort of like reiterates what was said. So on the only thing I would say, and we're going to continue doing this until the end of the academic year, so that will give us a whole year's data set. And I think it'd be really interesting then to do some analysis of that, which some of the Bradford interns have been doing, which is great. The only thing to say is that there are some limitations of this. Clearly, this is based on the views of the mental health champions. And so we're not claiming that this is an accurate reflection of exactly what's happening in school. It's not meant to be. It's meant to be that overall sense. So it is based on the perception of one person from that school. And obviously, if it's based on one person's perception, it might have been influenced by various different factors, including how they've coped during wellbeing, how they've and their own wellbeing there. And as well, I guess, because the main differences tend to be around social deprivation, are there some innate biases within the responses which have affected the data, which would need to be unpicked as well. So next slide, Katie. Yeah, so I've put that link on there and Katie will send this around. So if you do want to have a look, you can either look at the whole report, which is like huge and in depth, or you can look at the summary report, which is a 2-pager, and we'll probably give you all the key facts if you wanted to have a look at that. And once we've done the final bit of data collection over the next 2 terms, I'll be able to bring that back. So there's just a couple more slides as well. Christian asked me to stick a few slides in on this. This is about the emotional wellbeing and inclusion Chartermark. So this is something, we've talked about living well schools, and Sasha's already mentioned about living well schools. And one of the things that's going to come out of that next year is that, sorry, I've just got my phone ringing, I'm just going to shut up and go away. So one of the things that's going to come out of Living Well Schools is the Emotional Wellbeing Chartermark. So I'll give you a quick heads up about that, and people can start sort of like building into their thinking. So next slide, Katie. So if we just think about, this is what I presented last time. So next year, obviously education psychology will continue doing the core functions, but there is a huge focus on driving forward emotional wellbeing and positive mental health. And so within the mental health champions and the mental health champions plus, which is a more sort of like a full-bodied version of mental health champions, there's also going to be the emotional wellbeing Chartermark, which allows schools who have already put a lot of work into developing their culture around wellbeing to gain recognition for that and go through a quality assurance process. So if you just do the next slide. And so fitting it within the Living Well framework, so you can see that if we look down to the orange boxes, this is the emotional wellbeing Chartermark is one of the targeted interventions that people can opt into. So it's not something that everybody will want to do. It's not something that everybody will be in a position to do, but it is something that's available. And we were hoping to take at least, I think we've got 25 schools, sort of like a target of 25 schools for next year going through the emotional wellbeing Chartermark. So next slide. So it's fair, if you've done any other Chartermarks, if you've done the sort of like healthy eating and all of those other ones, it's about a whole school approach to improving whatever. And in this case, it's about improving student wellbeing. And it's universal, so that it's available to primary schools, secondary schools, resource provision and specialist provision across the district. And you'll work through, it's an audit-based tool, so you work through an audit, you'll come up with your sort of idea of where your strengths and your areas of development are, and then you'll work with the psychologist to do some work on them, and then you'll work through and be moderated and judged on that. So next slide. I'm not even going to read that, you can read that yourselves afterwards. It's basically, what Chartermark's for. And so what it will look like in practice is that the senior leadership needs to be up for this, really. It's not something that the mental health champion can do. It's about a whole school approach. So the senior leadership team need to engage with the process. And I assume it would be if it's on your agenda, then this is a good thing for you to be doing. And it's using the action research approach to engage and support the school and take them through this process. So there's the audit, then there's an action plan, and then there's various levels of support which you can access from education psychology through various intervention, training, various training support, various other interventions. It will probably take about a year to complete the cycle, but once you've done that, that'll be sort of done and dusted for 3 years, after which it's renewed. So next slide, please. And so next steps. So Sasha and I have now finalised this, so that's all sorted. We know that we're doing it and it's going ahead. The materials are absolutely almost ready. We're just waiting for them to be branded, and then they can be ready to go live. And we'll be recruiting our first cohort for the Chartermark beginning of the new school term. And then hopefully by July, this time next year, we're almost ready for the first. I haven't told Sasha that we need an award ceremony, but maybe, Sasha, if you're still on the call, I'll tell you now. We need to have an award ceremony and some sort of like big song and dance to celebrate. We'll have our first cohort of emotional wellbeing Chartermark schools, which we have. And I think just there's a few details on the next slide. There you go. So there will be more information coming out as and when. I want to get it onto the either onto Living Well or to the Health Minds website, and then people can go on there and have a look and pick up the details about that there. But if anybody's got any questions, or if they want to pick that up sooner, or they want to nominate themselves, then please feel free to email me and I'll get you on the list. Lovely. Okay, that's it. Thanks.
Fantastic. Thank you, Ruth. So Sasha's put in the chat, excellent work, Ruth, and looking forward to seeing this roll out over the year. Can I just say, I think I can speak for everybody in this call. We're very looking forward to the song and dance that we're going to have around the awards ceremony. So very excited about that. If there's any sort of questions for Ruth, again, please just put them in the sort of chat. really sort of pleased. So it looked like Helen had a really sort of busy sort of paediatric sort of clinic, so she was going to struggle to be here, but she has managed to be here, which is fantastic. So Helen, I know you've got sort of a few interesting bits of information to share with the group. So can I ask you to come in now, Helen, and just give us an update from your side?
Yeah, certainly. So I can't beat that. That was really interesting to hear and see. But really, just to keep you, to communicate what's happening here. It feels like business as usual. It's quite strange. So COVID, our numbers are staying relatively consistent, and there's sort of between 12 and 14 children a month coming into the wards. But most of those, as previously, are coming in with other medical conditions and being found to have COVID. We continue to have round about one a week coming in with this paediatric inflammatory disorder. And some children for that are needing a little bit more treatment and a 4 to 5 day stay in hospital. But in general, we're still not seeing massive issues. However, we feel like it's winter. Our intensity of work at the moment is similar to that we would normally see in about December. And we're beginning to see children coming back in with more significant exacerbations, for example, of asthma, coming in with croup and wheeze a little bit. So we're watching this space because it's escalating really quite quickly in terms of numbers coming into us. I think the main thing that I thought was interesting to share is we've been looking across the system in Yorkshire at how we look after children with long COVID and seeing if we can work as a system to have one clinic probably based in Leeds. But then every hospital in Yorkshire was reflecting that we're getting almost no children referred through to us with this. We're checking that they're not hiding in our general paediatric clinics, but we're not certain whether this is because children aren't coming forward or because they're being cared for in primary care or because our incidence in Yorkshire is much less than the rest of the country. So really, it was just to say, if you are aware of families where there are significant concerns for children who have had COVID and have sort of had a few month history of fatigue or headache, muscle ache, breathlessness, it is genuinely worth encouraging them to seek help and advice. It's more supportive care at the minute, but I think it's really important to ensure that children are receiving that as readily as adults. So yes, I think that's probably the main update at the moment.
That's wonderful. Thanks, Helen. Thanks so much for finding time to attend. It's really sort of great. And I will just say some really exciting sort of conversations that Matt's been relaying about good things happening in paediatrics and how we can help paediatricians work more closely with schools. So really exciting sort of stuff. So thanks so much for that. If there are any questions for Helen, please do put them in the chat and we'll come to those. But what I'll do now is hand over to Christian and sort of Duncan, and Duncan's going to pick up on some of the sort of questions which are in the chat. So can I hand over to you, Christian?
That's fine. Katie, would you share my slides, please? Okay, so we're focusing in amongst a lot of other things today on school staff. And just to give you the details once again here on the School Staff Welfare Support Service, those numbers there, and I've got Laura talking after me, where you can access the Wellbeing check, and the numbers are there for you to call today. So if you've got staff that you are concerned about, or indeed this is information you can provide just directly through to staff for them to be able to self-refer in an anonymous way, you've got a counselling and talking therapy offer for staff, from school cleaners right the way through to head teachers in school, and they can access that now. We've supported well over 60, close to 70 colleagues through this service so far this year. And at current levels of funding, we've still got capacity to be able to continue with that. And we have about 15 or 20 places that are available for the rest of this academic year. And that's a really powerful offer. To remind you about the grief and loss line and the guideline there, which are also available for you to be able to access. Once again, as well, the Seller Trust, the web links are on there. Katie will send this information out to everybody who's on the call tonight and anybody who's booked. Seller Trust are running courses on stress buster, improving sleep or sleep hygiene, low mood, and on suicide awareness. And there are one or two courses a week on each one of those, which are 1 or 2 hours. Very straightforward to access, and they don't need to be referred on to you by colleagues. Don't need to be referred on to that by a head teacher. They can just go and access it. So this is the health service. This is the CCG standing behind the school staff, standing behind those 5,000 teachers, standing behind the 12,000 colleagues who work in Bradford schools in other support roles. Next slide, Katie, please. I managed to get some feedback on the themes that are arising from schools in terms of the mental health concerns being presented by staff. And I think that you can read the things that are on the screen there, but the message I'm getting from head teachers and from the service is that they saw a surge of need and interest when the service was launched in December and into January, particularly over the Christmas period, and then it was fairly steady. And then as teachers have come back into, I'm going to describe it as normality if you know what we mean, but into the circumstances we're in now, there was a drop off. But then as things started to carry on, we've seen a rising number of interest and concerns being reflected. And I think that's perhaps, I'm no counsellor, but that's perhaps when you're moving away from that fight and flight where you can deal with the crisis that's in front of you. And when it comes back to normal life, sometimes that's when you've had a chance to reflect on things. It's the same reason why you get mental health concerns which present themselves at the weekends rather than the middle of your Year 7 geography lesson. And those themes that we're seeing there around, profoundly around grief and loss, a lot of those themes there on the next 6 bullet points are themes that are of mental health concern by school staff that have been presented for a long time. These are not new mental health concerns and mental well-being concerns, but they've been amplified because of the experience of colleagues who've lived through COVID response. And so it is the double whammy really of the stress and strain of the profession and the additional strain that's been put on teachers through the experience of COVID. But it's been wonderful to see the system standing behind them, and we will look to sustain that support into the new academic year. I'm going to hand over now really to Laura, but just to let everybody on the call know today that the next 2 webinars that we'll be having after half term are around physical health and physical well-being, and there'll be 2 special editions on that as well in June and July after half term. So I'm going to hand over to Laura now. Thank you.
Hi. Briefly, I just wanted to let you know about the collaborative, which is each service within the Bradford districts that have come together to be able to support projects like being at the back of teachers and helping them out to utilise the skills, which means that people have got no waiting lists. There's been a steady flow of people coming in, lots of skills and experience. The main reason was to help to manage stress, worry, fear, anxiety, all of those things during the pandemic. Initially, I think people thought about bereavement, but you'll know in the profession that you're in, it goes far, far greater than that. And there's so much loss for people that it does become anxiety provoking for lots of reasons. So we feel that Bradford really benefits because there's such a richness of local providers situated within communities. And commissioners have been really forward thinking in being able to tap into that as and when it's required, sort of above and beyond what's provided in a statutory way. So we've been really proud to be a part of that. I'm ready to go on to the next slide, please. Okay, so just to give you a little idea of how people are trained, all of the counsellors and therapists within the collaborative have obviously had formal training, and there's a real mixed toolkit really, from cognitive behavioural therapy, systemic therapy, person-centred stuff, integrative therapies, TA, solution focus, brain working recursive therapy, all of which is once a referral's come in and someone's being assessed, everything sets off in a person-centred way in hearing what the person's issue is, but then matching them with the right therapist to be able to move forward as quickly as possible, really. Ready for the next one? Thank you. So in terms of the head teacher project, it was felt initially, and rightly so, that confidentiality was a sort of primary issue. So the services being completely confidential and safe for people to access. We've really tried to make sure that people understand it's not just about bereavement, it's about sort of the losing of yourself. Lots of people have been on such a treadmill. And as you were saying before, I think the idea of the world opening up again has almost let people be able to breathe out again, but in breathing out and thinking about them rather than supporting, especially the senior leaders, have been supporting all of the other staff, been supporting the children. So once they've taken a second to just sort of breathe, they've recognised that they need they're sort of running on empty and need a little bit more to work out how to go forward. So the first step for people, we do a wellbeing check, which covers loosely things like sleep, if that's affected, levels of stress, connectivity, how much balance there is in seeing other people, the amount of exercise that people are able to access, and the risk to their emotional health, and also the risk to the work. I think people are used to just being like ducks to water and managing everything well, but there's so much that's out of people's control and so many additional considerations to keep everyone safe that the pressure of that is impacting either on health or home or time in general, and just that sort of feeling of panic of not doing everything well, although, you know, I'm sure people are doing things very well. So from the wellbeing check, there's an option to be sort of signposted to guided self-help through all of the statutory and voluntary services that are available for people who just want some guidance in how to help change some behaviours or get better sleep, or whether it's a health thing, whatever that is. Or the second option, where people have got more complex issues, or one of the things that we're finding is lots of people are very new to therapy. They've never been in it before, so they're a little bit scared of it, a little bit not sure what will happen, but just needing that sort of space to work out what it is they need to move forward. But often we're having to go back. There may have been an unresolved issue from childhood, an adverse event, trauma, whatever, that the way that they're feeling right now in COVID has triggered. So obviously those kind of issues are a little bit more complex. So they're kind of referred in for therapy, a minimum of 6 sessions, but where needed, where there are complexities, we can offer more. And that's it from me. Thank you.
Yes, it's true. Okay, is this me now?
Yes, it is.
Right, okay, it's me again, I'm afraid. I won't take long on this one. So it's just to sort of bring you up to date really on the Living Well Schools thinking. The last webinar I gave you just sort of an overall structure around physical, social, emotional, mental health and classroom inequalities. So we're still working on that. But what we've been doing since is trying to populate that full of the actual things that are going to support your school. And Sasha, Laura and Ruth have talked around mental health already, but we also want to put into that the relationship and sex education specialist support that we've got around Step 2, James and Hale, so that will be going into that. So that's the example there. And then within physical health, we've got the Jump scheme, and we're looking at a universal offer for schools around reducing obesity, so a Tier 1 obesity offer, ground physical activity and whole school food policy. And then there's various other practical resources like the 50 things to do before you're 5 and so on. And then we want to try and extend this. We've got the Childhood Obesity Trailblazer project at the moment, and that's about looking at madrasas and mosque schools and what we can do to support that part of the education sector as well, because we know that school doesn't sort of end at 3 o'clock for a lot of kids from Muslim backgrounds as well. And then the asthma aware schools is another example of someone I've been talking to within Bradford Royal Infirmary about that approach as well. And we're really trying to package all these things up now. And then the classroom inequalities is another area around the holiday activity and food programme, the digital inclusion project and so on. So we've got actual specific interventions. So in the background, we're building all that into a website and a simple prospectus that we're hoping to launch during the first term of next school year. But I want to sort of re-emphasise that this is going to be about evolution, not revolution. And rather than waiting until we've got it all perfect, we're going to be developing this as we move through the school year. We're not going to put everything in the prospectus. That's going to be delivered to you via the website, because as soon as you put a list of services in a prospectus, it becomes out of date on day 2, doesn't it? So we're going to try and keep that up to date with good communications as we move through. But what I want to do is just take this opportunity to get a quick straw poll from you as well, because we've got the opportunity to bid with some funding through the Department of Health to invest in initiatives that protect mental health. So we're talking to Ruth and Sasha about that, but also really upstream things and recognising the impact that poverty has on poor wellbeing. So there's this poverty proofing the school day concept. And this is about that whole school ethos in terms of mitigating the impact of poverty and reducing the stigma and the way that staff and the way that school children talk about poverty as well, or not about poverty as it might be, and trying to reduce that sort of otherness that it affects some children than others. Now, we've got different ways of doing that. As usual, we've got a really short win deadline, and we've got to put in a bid by Thursday. So it's sort of, again, thanks very much for giving us 4 days on that. But and they want us to do a lot of engagement with the community in 4 days, which we can't do. But what I can do is engage with you now about what the best way to introduce a poverty proof in the school day concept into schools, particularly in more deprived areas. And we've got 2 different models that we're thinking of. So what I want you to do in a second is either put 1 or 2 into the chat, so I can get a quick straw poll of what's the best thing to do. The first option that we can do is bring in an organisation to train teachers up within schools. And that will be 2 days worth of training, and then those teachers will become the champions of poverty proofing the school day in schools for the schools that want to be part of this. So that's option 1. That's very much school led. And option 2 is that we put some of the resources into building district wide champions that will go around to schools and support you in this initiative. They will be people with school experience, preferably ex-head teachers. And then you'll develop a school champion within the school, but the onus will be very much more and more support at a district-wide level from the local authority. So option 1 is very much school-led. Option 2 is more of a blended model of local authority with your blessing. So if you could put 1 or 2 school-led blended approach with district authority into the chat now, and I can just see how many 1s or 2s are, and that will help us with our bid. Okay, that's all from me. And as I said, we'll keep you up to date with the Living Well schools as we go along. Right, how many have we got there?
I don't know. I think mathematics skills are going to be put to the test now. Can I just say a massive thank you to Laura, and Christian and sort of Duncan for their great insights as always. To try and keep us on time while you're all voting in the sort of a chat. I'm going to do our favourite section now, our talking head sort of section named after Alan Bennett, not the American rock band, and hand over to Lynette, who's going to very quickly tell us about Swoosh and the mental health survey. So over to you, Lynette.
I like the idea of being in a rock band though, so I'm disappointed that that's not on the cards. Evening everyone, I'm going to keep mine very short and sweet because of time, of course, and lots of things that I was going to talk about have already been mentioned. So particularly around the swoosh offer, which is something that I've spoken about before and we speak about a lot on our get-togethers. Listening to things and my own reflections are so much more out there now than we have ever had in our profession, which is absolutely fantastic. Is it disappointed that's off the back of COVID? I don't know, but it's great to have that opportunity and those things out there at the moment. We do stuff that you yourselves are all already doing, and I know that you will be doing the same, so I'm not going to say anything you don't know, particularly mental health training, but we have utilised the swoosh offer across all our schools, sharing that with anybody who deals with operations, HR, business managers, and I'm hearing it mentioned more now, that rather than me shoving it under noses, as I'm known for doing, people saying, oh, what about swoosh? Should we offer that? Could we do that? Which is really good to hear. Staff are giving reminders because, of course, as we've said before, it's a self-referral service, and that decision to self-refer is a very bold and brave decision to make. And that is becoming more of a common thing really for us. I do know of a couple of staff that have accessed it, and they have spoken to me about it since, and been a little bit like a weight off the shoulders to have someone to talk to that's not associated with school, somebody that's absolutely separate. But the speed, they talk about the speed at which they've been able to get support, not being on a waiting list and that way. It's a little bit like strike while the iron's hot. I need to talk to someone, I need to self-refer, and that support is there for them. Main issues and trends that we are noticing in particular, very much as Christian was saying earlier, workload management. People are struggling more with that now, and I think that is really boiling down to the fact that people are close to that burnout point. A lot of the staff, particularly I see it in the leaders that have worked throughout the pandemic and ongoing, that they haven't had the proper break and the rest, and when they have the ability to switch off mentally is very, very difficult. That's coming more to a head for us now. So that emotional resilience particularly, and people are probably more sensitive, feeling a little bit fragile, and particularly because, I don't know about anyone else that's counting, but I think we're on 10 weeks to the summer, something along those lines. I can see people laughing, so I'm not the only one. But I think that light is at the end of the tunnel of we're going to have a decentish break, and we've made it, and it's the relief. We've done it, we've made it. Particularly those who've experienced loss, as Christian has said. I lost my dad a couple of months ago. I found that very, very difficult. And for me, I find when anything happens, it takes me right back there, right back to that emotional pace. And it is that setback every time. And I can see that in other people much more now. Environment, as always, I do believe we get our environments right for people and that culture right for people, and we can do whatever we want to do. But my final word really is just about being kind. We are trying to be as kind as possible to our staff, keeping our children the focus, getting us to the finish line, where I'm hoping there will be, I'm going to reference it again as always, some lovely night out with maybe a little glass of gin and tonic for us all.
So Lynette,
thank you everyone.
Thanks Lynette. You're off the chocolate, back on the alcohol. So
absolutely, yeah.
No, thanks so much, Lynette. I saw a massive smile from John when you sort of said 10 weeks to go. So he's definitely on the same wavelength. I've got to say, it's like the Matrix here. We just got like ones and twos with sort of a Christian and Duncan trying to sort of interpret what's sort of going on here. So thanks very much, everybody, for doing that. Millie has put a question about how we access Swoosh, so we'll get all that information to you, Millie. But if I can hand over to John now, who's going to be telling about his school's approach to daily happiness.
It depends if you talk about the school's approach or if the kids ever think that I'm happy. So they're probably two different matters, but it was interesting what Lynette said. It's about culture and ethos, and in terms of approaching about happiness and well-being, that's something that we put at the centre of what we do. And so a lot of the stuff we talk about are just sort of quick wins, and some of them are taken from other people when we've been talking about that. So in terms of well-being, we're lucky that we can access the Swoosh support. We're also, as a mental health trailblazer school, we've got that access to a support, and we have an employee assistance program as part of our Academy Trust. So we're very fortunate in that stance. We have wellbeing groups that help decide some of the strategies for happiness and what we do. But happiness starts at the front door by welcoming everyone in. So teachers and students, we have a policy of making sure you say hello and good morning to people. There's none of the looking down on the floor when you walk past people in the corridors. We have 115 staff and nearly 700 kids. So it's a lot of hellos and good mornings, but it sets the culture and your environment for your school. We have a staff shout out board, which is up in the staff room. For each half term, we put it up there for people just to say thank you to someone else. So it could be someone's helped you out, someone's covered you for something, for whatever reason. And it's sometimes the most trivial things that are most important to people and shouting out. So that normally costs me about 5 or 6 boxes of chocolates a half term, but that's good. Cake and chocolate will come up a lot in our themes here. We have thank you awards. During the pandemic, quite a good one is like on a Friday morning, I stood at the front door, just gave every member of staff a chocolate bar as they come in, just to say thank you, enjoy it with your break. 115 chocolate bars later, people are smiling. I think a lot of what we've realised over the time is that little touches make a big difference. So it's not the big events or wins, it's just little things make people feel appreciated. We've got an ice cream van due next Friday. I know Lynette's got a coffee van on the same day, and we were discussing strategies around what sort of food or drink we give to staff. So little things again about just making people smile, because it has been a long, tough term. But I think all the time, role modeling positivity, being polite to people. And so I have a big thing on manners with all of our students. And I think I've said before, they get a 2-hour detention if they don't respond to me by saying good morning or hello, just because I think we have to role model that. But role model in our staff. We have cut-offs for email. We make sure people say please and thank you. And we have no, probably I'm the only ego at the academy, but we have no egos for people. So it doesn't matter what role or job you do. You have to be polite and respectful for everyone. Yeah, I just think it comes back to culture and happiness. And that way, we have people smiling. I mean, we've had some tough times this year. We've had staff, we've had people know we had a member of staff have a heart attack on site, and it was a really challenging time for the staff. But we try and do everything we can with a smile, and we look out for each other. And the little bits make a difference, and that's helping us to get to the end of it. And yeah, I am counting down to the 10 weeks, but as we're in a GCSE assessment this week, I'm going back to supporting marking and exams tomorrow. So yeah, that's just what we're doing here at UAK, and some of the bits I have nicked off other people along the way. So I take no responsibility for any of the ideas.
Brilliant, thanks, John. Duncan's asking if he can get a job at your school. I think so. What we're hearing is gin, chocolate, coffee. You won't go far wrong. No, that's wonderful. Thanks so much, John. Beth, can I ask you to talk to us about your perspective on staff wellbeing from that special sort of school angle?
So I think a lot of the things are very similar to what Lynette and John have said, just in terms of the basics. I think in terms of for special schools, there's sometimes some additional pressures that are there for staff beyond the workload and the day-to-day challenges that they might face. I think 2 of those are particularly around behavioural challenges that they might be on a day-to-day basis, and coming in to face that every day, and that burnout can therefore happen a lot quicker in terms of how people manage that. But really, like, focusing on relationships, making sure that ethos is and culture is there, where there is an open door, people can talk, they have time to reflect, there's those safe spaces for people to be able to come and talk, to let off steam, and a real focus on being able to rebuild relationships with students all of the time, and to depersonalize things. I think the other thing that is perhaps more unique to special schools is around palliative care for young people. So young people who are on palliative care plans, who have got life-limiting conditions. We've had 3 young people who have passed away during the COVID pandemic, not due to COVID, but and that's been hard because we've not been able to come together as a community in the same way as we would usually. So finding ways around that to be able to come together, to be able to support each other, because as much as within the class team they might be able to support each other, obviously the wider community have had a lot of contact with those young people beforehand. So really being able to think about the impact that has again, being able to give people space in more normal times for people to be able to attend the funerals as well, irrespective of the impact that might have on school staffing during that day. But those chances for people to have, for ways to be able to say goodbye and to remember young people, and again, having that opportunity to be able to, creating that culture where people really do feel that they can come and talk, and they don't have, it's totally normal to not feel like you can just get on the next day and it be all okay, and that being okay, basically. And then with that, the signposting to different services that might be available, and to different offers if people do need that additional support beyond what's in school. So I think they're two things. I think a lot of the things are very similar in terms of the small things mean a lot. And I think for all of our young people, it's just remembering what a privilege it is to be a part of their lives, what with the time that we have them in school, and looking at things slightly differently sometimes in terms of what you're looking for that can really help with staff well-being, in terms of it not always being a focus on academic success, but actually that emotional regulation, successes in engagement, are really important as well, because if you can focus on those, you can start to see those positives, which sometimes it can feel like you're not making that academic progress in the same kind of way. So a number of different strategies that can just really help to keep people going when times are hard. I think that's it from me.
Brilliant, thank you, Beth, so much, and yeah, really heartening sort of words. So our final talking head is Rob, who's going to talk to us about the DfE Wellbeing sort of charter. So over to you, Rob.
Thank you very much. I have to admit that when I joined the planning session for this session last week, I was, to use a Ruby Wax term, feeling somewhat frazzled, having just dealt with some lunchtime issues. I joined the meeting 10 minutes late, and when Christian said, "What would you like to talk about?" I drew a blank, because although I know we do lots in school and we're constantly reviewing staff wellbeing, it's part of our kind of regular conversations. At that moment in time, I couldn't think what I wanted to talk about. But thanks to John and Lynette, who happily pointed out that hot off the press was the Education Staff Wellbeing Charter, just here, and I've shared it with you in the chat as well. And actually, it's really timely, because it's a really great document, I think, and it brings together all the strategies that a school could potentially use to support staff wellbeing going forward. So it's not in place yet, but it's recommended that schools sign up to this in the new academic year. It's a joint document on behalf of the DfE, Ofsted, and alongside the unions, and then schools are invited to sign up to the charter to show what they're going to do to support education staff wellbeing going forward. There's a definition of wellbeing within the document, and that has been agreed by the DfE's expert advisory group. So I am just sharing information with you today, kind of not telling you things that we're doing. And this definition of wellbeing is a state of complete physical and mental health that is characterized by high quality social relationships. And I think that's a big thing. Lynette talking about the gin and tonic. We've got our staff do booked in. Whether we get there or not is another thing, but we've booked it in the hopes that we might be able to. And I think it is that social element that I've really started to pick up on over the last few weeks that people are really missing out on. And actually, a few members of staff have talked about the loneliness that they're feeling, even though they've got family and friends around them, actually not being able to kind of be in touch with those people in the same way is really starting to take its toll now. So in terms of the charter, just to kind of give you a kind of brief overview of that, really, the DfE have made a range of commitments, and included within that are issues around driving down unnecessary workload, around flexible working, and thinking about how we can support that, and embedding wellbeing into professional development of staff, you know, as you're kind of planning for your professional development work going forward. Ofsted has said that they are committed to taking staff wellbeing into account in coming to their judgments, and the impact of Ofsted on staff wellbeing, we know that can be a major issue for all of our staff, but they're making a commitment to kind of bear that in mind. And again, a reduction in workload in terms of preparing for inspections and what's expected from school leaders. In terms of the organisational commitments that are expected from schools, the things that we would be asked to sign up to, as I said, it brings together a range of different strategies. And I think the thing that comes through for me is around the fact that staff wellbeing is everybody's responsibility. It's school leaders and staff responsibility, but also it's about how we can look to one another to support wellbeing as well. And it's around signposting to support and building a safe environment where staff can share experiences around mental health, so that we're kind of listening to their voices in terms of how we move forward. The other good thing I thought was that's built into this is the balance of senior leaders' responsibilities for staff mental health, but also that we have to support our own mental health as school leaders as well. So just to give you really briefly a flavour of some of the other things. So it's around the drive down for unnecessary workload, supporting staff to progress in their own careers, and then how we hold ourselves accountable as a school to make sure that we further reduce and improve mental health and well-being for staff going forward. We'll definitely, as a school, I'm glad it's kind of come to my attention that it has started to be promoted in terms of communication from the DFE over the last week or so. I've included it in the chat here, but we'll be signing up at Saltaire Primary because I think actually it encapsulates what we want to achieve going forward. So it will form part of our staff wellbeing policy from September as well. And I believe there'll be further information in the autumn term for all schools too. So a little kind of a summary of what that document's all about. Hope that was useful in some way.
Really useful, thank you, Rob. And Ruth has said that she's going to ensure that it's incorporation of emotional well-being. So this again is all about us working together to try and make this as simple as we possibly can for everybody across the system. So thank you so much. Huge thank you to all our speakers. We will finish at 1:30. There is one unanswered sort of a question that Duncan's going to quickly take now.
Yeah, so there was something in the chat earlier about ending staggered start times at the end of schools. That hasn't changed in the guidance, I'm afraid. So and then I think the question was sort of, is this all right? It's impossible to say without knowing the school and knowing the situation. But if you're going to come away from that guidance, I think you have to have a really good reason for it. And you need to do a risk assessment really on whether that's going to increase throngs of children coming in and out of schools. I checked the DFE May guidance. So this was released last week with all this new stuff around face coverings. And it still says consider staggered starts or adjusting start and finish times to keep groups apart as they arrive and leave. So that still is the guidance on that one. And then the other question was around face masks and parents. I think George put something in the chat about that, but the expectation is that anybody visiting the school will still be wearing face masks. And if you can enforce that, try and enforce that in groups of parents around the school gates as well, that's even better. Again, it's just around reducing the risk. It's not an exact science, it's just about reducing the risk where you can.
Fantastic. Thank you, Duncan. Thank you to all of our speakers, as always. Great informative talks from Sasha, Duncan, George, Helen's Rajat, Ruth, Christian, Lynette, John, Beth and Rob. Really fantastic evening as always. I think we've managed to finish on time, miraculously. Thank you to everybody for coming on today, and we look forward to seeing you at the next webinar. So we'll say good night.